Hello everyone, this is Dr. Sam and today you will learn about CT of normal pancreas and acute pancreatitis. These are contrast-enhanced CT images of the abdomen in the axial plane during the arterial phase and the portal venous phase. This is the pancreas located behind the stomach in this image. The splenic vein is a good landmark for locating the pancreas on CT scans. The splenic vein runs along the posterior surface of the pancreas, specifically the body and tail. It courses from the spleen towards the liver, eventually joining the superior mesenteric vein to form the portal vein. This is more clearly seen in the portal venous phase because these veins are enhanced. The normal pancreas has an elongated shape and is slightly lobulated. It will appear homogeneous in normal cases. The gland's length is between 15 to 20 centimeters. The width of the pancreatic head is 3 centimeters. The width of the body is 2.5 centimeters and the width of the pancreatic tail is 2 centimeters. The pancreas tends to decrease in size with advancing age. This reduction in size is part of the normal aging process. On imaging studies like CT scans or MRIs, an older person's pancreas might appear smaller. Acute pancreatitis is a sudden inflammation of the pancreas that can range from mild to life-threatening. On a CT scan, its severity can be determined. The Balthazar score, also known as the CT Severity Index, CTSI, is used to assess the severity of acute pancreatitis based on findings from a CT scan. This scoring system helps determine the extent of the pancreatic inflammation and necrosis, which is important for prognosis and management. CTSI, short for CT Severity Index, is calculated by adding the points from the Balthazar grade, which assesses the severity of pancreatic inflammation, and the necrosis score, which evaluates the presence and extent of necrosis. What I am talking about here is actually the older CTSI system. This system had some limitations. One limitation was that it does not take extrapancreatic complications such as ascites, bowel wall thickening, vascular complications such as splenic vein thrombosis due to pancreatitis into context. Later on, a modified CT Severity Index was created. It was more accurate in evaluating the severity of pancreatitis. We will be looking at the newer modified CTSI instead of the old one. This includes both pancreatic and extrapancreatic complications. MCTSI includes 3 categories: pancreatic inflammation with a score ranging from 0 to 4 points, pancreatic necrosis with a score ranging from 0 to 6 points, and extrapancreatic complications with a score ranging from 0 to 2 points. The first category is pancreatic inflammation. If the pancreas appears normal, it is given 0 points. If the pancreas just appears enlarged and there is no peripancreatic fluid collection or fat stranding, 2 points are given. If there is presence of peripancreatic fluid or fat stranding, 4 points are given. The second category is about pancreatic necrosis. If there is no necrosis, 0 points are given. If the necrosis is less than 30%, 2 points are given. If the necrosis is greater than 30% of the pancreatic parenchyma, 4 points are given. The third and final category is about extrapancreatic complications. If there is presence of one or more complications such as pleural effusion, bowel wall thickening, splenic vein thrombosis, or superior mesenteric vein thrombosis, 2 points are given for this category. But if these complications are not present, 0 points are given. The MCTSI is calculated by adding the points from pancreatic inflammation, pancreatic necrosis, and extrapancreatic complications. If the total score is between 0 and 2 points, it is classified as mild pancreatitis. If the total score is between 4 and 6 points, it is considered moderate pancreatitis. And if the total score is between 8 and 10 points, it is classified as severe pancreatitis. Now we will compare the CT appearance of a normal pancreas with that of acute pancreatitis. The MCTSI score will also be calculated for all cases shown here. A normal appearing pancreas will receive a score of 0 for both inflammation and necrosis. The pancreas is not enlarged and there is no necrosis. Additionally, there are no extrapancreatic complications, so that is another 0 points. Therefore, the MCTSI score will be 0. In some mild cases of pancreatitis which are diagnosed clinically, the pancreas may appear completely normal on a CT scan and will have an MCTSI score of 0. However, this is a normal pancreas in a patient who did not have pancreatitis. This is just for comparison. Acute pancreatitis is of two types: interstitial edematous pancreatitis (IEP) and necrotizing pancreatitis. This image is during the arterial phase. It shows acute edematous pancreatitis. In this type, there will be either diffuse or focal enlargement of the pancreas without any necrosis. In this image, there is diffuse enlargement. There is no dead pancreatic tissue in this type. The pancreas just appears swollen. The inflammation score will be 2 points. The pancreas is enlarged without any peripancreatic fluid or fat stranding. There are no signs of necrosis, so the necrosis score will be 0. For simplicity, I have omitted the third category, peripancreatic complications. In cases where it gets 0 points, I will only mention it where it is relevant. In this case, there is only pancreatic enlargement, so the total MCTSI score will be calculated by adding the inflammation score and necrosis score. So 2 plus 0 is 2 points. The MCTSI score is 2 points. 2 points correlates to mild pancreatitis, so this will be labeled as mild pancreatitis. These images are taken during the portal venous phase. You can see a part of the enhanced splenic vein and superior mesenteric vein in this phase behind the pancreas. This is the pancreas, and over here is another image of acute interstitial edematous pancreatitis. The pancreas appears enlarged without any peripancreatic fluid collections or fat stranding. Inflammation score will be 2 points and necrosis score will be 0 points since there is no sign of necrosis. There is sufficient enhancement of the pancreas. The MCTSI score will be 2, that is mild pancreatitis. This image of pancreatitis is taken during the arterial phase. It shows an enlarged pancreas. A swollen pancreas is easier to locate than a normal pancreas. Sometimes the pancreas can have a heterogeneous appearance. Now in this case, fat stranding is present around the enlarged pancreas. These bright areas are fat stranding. I will explain to you shortly what fat stranding is. First, we will do the scoring. The inflammation score will be 4 because of the presence of fat stranding. There is no sign of necrosis. The enhancement is adequate, so the necrosis score is 0. By adding the inflammation score and necrosis score, we get 4 plus 0 equals to 4 points. So any score from 4 to 6 indicates moderate pancreatitis. Fat stranding refers to inflamed fat tissue. On CT scans, fat stranding appears as streaky areas of increased density within the fat surrounding the pancreas. This increased density results from the infiltration of inflammatory cells, fluid, and sometimes fibrosis, indicating an inflammatory process. This hypodense area near the pancreas is the normal fat tissue. When it gets inflamed due to pancreatitis, in this case, it will appear brighter and have a streaky appearance. In this image, you can see the splenic vein and the superior mesenteric vein more clearly. They are located just behind the pancreas. This is the pancreas. The image on the right is of another case showing fat stranding associated with acute pancreatitis. You can see this brighter fat tissue. This is the normal fat tissue. It is darker, hypodense, and this is the inflamed, brighter, hyperdense fat tissue. The inflammation score is 4 because of fat stranding. The necrosis score is 0, so the MCTSI score is 4. It is moderate pancreatitis. In this case, there is focal enlargement of the pancreatic body and tail. The body will measure greater than 2.5 centimeters and the tail will measure greater than 2 centimeters. Here you can notice fluid next to the pancreas. This is peripancreatic fluid collection. Fluid appears hypodense. It appears slightly darker than fat stranding and will usually not have a streaky appearance. However, there can be some overlap between appearance of fluid and fat stranding in a few cases. Whether it is fluid collection or fat stranding the inflammation score will be 4. The pancreas can be seen enhancing. There are no signs of necrosis, so the necrosis score will be 0. The MCTSI score will be 4, that is moderate pancreatitis. Here is another image of a normal pancreas. It appears thin and homogeneous. A part of the splenic vein can be seen, and the pancreas is found anterior to the splenic vein. You can compare this pancreas with this inflamed pancreas. It appears enlarged and has a somewhat heterogeneous appearance. Peripancreatic fluid is present, so the inflammation score is 4 points. This image is from a slightly lower level than the previous one. You can see more peripancreatic fluid here. The necrosis score is 0, so the total MCTSI score will be 4. It is moderate pancreatitis. In this case, there is a significant amount of peripancreatic fluid. Hypodense fluid is noted around the inflamed pancreas. The inflammation score is 4 points. The necrosis score is 0 because the pancreas has normal enhancement. The MCTSI score is 4, moderate pancreatitis. In this image, there is fluid outside the pancreas. This is the interface between the pancreas and the fluid. The pancreas is seen just anterior to the splenic vein. It is slightly brighter than the fluid and has adequate enhancement. The inflammation score is 4, necrosis score is 0, and the MCTSI score is 4, indicating moderate pancreatitis. In this image, we can see a part of the pancreatic body and tail with a large peripancreatic fluid collection. This hypodense fluid is located in the left anterior pararenal space. The pancreas enhances normally, so there is no sign of necrosis. The MCTSI score is 4. Autoimmune acute pancreatitis has some specific signs on CT scan. There is often diffuse enlargement of the pancreas. The inflamed pancreas may give a sausage-shaped appearance, and there is a hypodense rim around the pancreas on contrast-enhanced CT. You can notice a thin gray hypodense border surrounding the pancreas. It may either completely or partially surround the pancreas. This feature is usually seen in autoimmune acute pancreatitis. In this case, only pancreatic enlargement is seen. There is no fat stranding or peripancreatic fluid collection. MCTSI score is 2, indicating mild pancreatitis. Here's another image showing autoimmune pancreatitis. The pancreas is enlarged and appears somewhat sausage-shaped. The hypodense rim can be seen around the pancreas. There was no fat stranding or peripancreatic fluid collection. This was graded as mild pancreatitis. The second type of acute pancreatitis is necrotizing pancreatitis. In this type, necrosis will be found within the pancreatic tissue. Normally, the enhancement will be seen throughout the pancreas in a contrast-enhanced CT scan, especially in the portal venous phase, but in necrotizing pancreatitis, a part of the pancreas will not show enhancement. Hypodense areas are seen inside the pancreas right next to the enhancing pancreatic tissue. If the hypodense areas are seen within the pancreatic tissue, during the portal venous phase, they indicate necrosis, and the hypodense areas seen outside the pancreas will indicate peripancreatic collections. These collections can be fluid or fat stranding and necrosis outside the pancreas. Also, there is diffuse enlargement of the pancreas. The inflammation score will be 4 due to the presence of peripancreatic fluid. Necrosis is present in this case. By looking at the pancreas, it appears that the necrosis is less than 30% of the pancreatic parenchyma, so a less than 30% necrosis gets 2 points. Along with necrosis, extrapancreatic complications are found in this patient. There is a fluid collection at the splenic hilum. Bowel wall thickening is also present. The normal bowel with contrast will not show this low density dark wall thickening. And we can also see extension of the peripancreatic fluid. This image is from a lower level from the previous image. The third complication was left-sided pleural effusion. The normal pleural cavity will appear very hypodense or black, but in a pleural effusion we will find gray hypodense fluid in the pleural cavity. This hypodense area indicates pleural effusion. 3 extrapancreatic complications were present in this case: fluid collection at the splenic hilum, bowel wall thickening, and left-sided pleural effusion. Whether there is a single complication present or 3, the points given for extrapancreatic complications will be 2. Now we will calculate the MCTSI score. 4 points from inflammation plus 2 points from necrosis and 2 points from extrapancreatic complications. The MCTSI score will be 8. A score of 8 is classified as severe pancreatitis. This is another case of necrotizing pancreatitis. The inflamed pancreas is surrounded by fluid, so 4 points in the inflammation score. Non-enhancing areas can be seen within the pancreas. These are the non-enhancing areas. As we move downwards, there are some more non-enhancing areas in the pancreas. This degree of necrosis is definitely greater than 30% of the pancreatic tissue, so the necrosis score will be 4 points in this case. Left-sided pleural effusion was also present in this case. This hypodense fluid is the pleural effusion. Due to this complication, 2 points will be given. By adding up the inflammation, necrosis, and extrapancreatic complication scores, the MCTSI score will be 10, classified as severe pancreatitis. This is the maximum score that can be given in the Modified CT Severity Index. Here is another case of necrotizing pancreatitis. The pancreas is enlarged. within the pancreas, you can see this enhanced area, while the rest of the pancreas is not enhanced. This area indicates necrosis. The inflammation score will be 4 because there is peripancreatic collection. If it becomes difficult to distinguish between peripancreatic fluid and fat stranding, you can just call it peripancreatic collection. The score will be 4 whether it is fluid or fat stranding. More than 30% necrosis is present, so the necrosis score will be 4 as well. There was no extrapancreatic complication in this case, so the score will be 0 for extrapancreatic complication. The MCTSI score will be 4 plus 4 equals to 8, which is severe pancreatitis. In this image, a large portion of the pancreas is not enhanced. From contrast, it appears hypodense. Only a small portion of the pancreatic tail is enhanced. The inflammation score is 4 due to peripancreatic collection. The necrosis score will be 4 as well for a necrosis greater than 30%. There was no extrapancreatic complication. The MCTSI score was 8, indicating severe pancreatitis. Necrotizing pancreatitis will usually fall within the severe pancreatitis range. The necrosis is also present in this case of pancreatitis. More than half of the pancreatic parenchyma is not enhanced. Only a small portion of the tail is enhanced. In some cases of necrosis, gas can be seen within the necrotic areas. Gas can be present either in or just outside the pancreas. This is a sign of infection. This gas is produced by the bacteria. These very low density black areas are gas. With the presence of gas, it is often called emphysematous pancreatitis. Inflammation score is 4. Necrosis score is 4. There was presence of peritoneal free fluid in this case, so for extrapancreatic complications, it gets 2 points. This gives an MCTSI score of 10, that is severe pancreatitis. This is another case of an infected necrotizing pancreatitis with the presence of gas within the necrotic areas. The pancreatic head and body fail to enhance with contrast material. Only the tail end of the pancreas is enhanced. Inflammation and necrosis scores are both 4. Peripancreatic collection is noted and the necrosis is greater than 30%. Peritoneal free fluid was found in this case as well, so extrapancreatic complication score will be 2. The total MCTSI score will be 10, the highest score possible. It is classified as severe pancreatitis. Thank you so much for watching. Please subscribe and stay tuned for more imaging videos.